sabotaging your health. I think it's a good thing to question yourself, because in my experience of 20 years of being a personal trainer and a wellness consultant, empowerment coach, there were these times, especially early on, where I'd be working with clients and they'd come to me and say, oh, I want to lose weight, or I'm here because I have this knee injury and I'm trying to rehab, or I want to improve in my sports. It was like a whole range. I've worked really with an entire range of people, and there was like this sticking point for me where here I was, this supposed professional with this degree in exercise kinesiology and exercise physiology, and I had done all of the national certifications that I was supposed to do and all of that continuing education, and I was stumped because here I was working with these clients, and no matter what I did, no matter what exercises or programs or whatever, it was as if nothing was changing, or something would sort of change and then it would go back. They would lose the weight, and then 6 months later it would be like they were just coming back to me all over again with the same thing. Or the knee pain would go away, but then it would turn into shoulder pain. Or it was like, what is going on here? It was so weird, and to me it was really elusive. And so I began to study, what is this going on? Why is this happening with people? And this is where I began to realize, wow, these are these red flags. It's not about what we're doing on the outside to help these people, but what is happening within them, that maybe they're sabotaging their own health. For instance, do any of these sound familiar to you? Lack of motivation. You are all gung-ho to start your workout program or any project that you might have in life, and then somewhere along the road, a month or two, or maybe a few months later, it's just like you have no motivation to do it at all. Lack of motivation is a form of self-sabotage. Chronic pain and injury. This was a huge one for me when I was working a lot with a lot of clients that were coming to me for chronic pain and injury, where, like I was saying, the pain would shift from maybe their knee to their shoulder to their back, and then they'd get migraine headaches. It was just so weird to me. So chronic pain and injury, another form of self-sabotage. Of course, we've talked about this one before, the inability to lose weight. Here I am dieting, I'm exercising, I'm eating right, I'm doing everything right, but how come I'm not losing weight? And then, of course, last week we talked about the food addictions, another form of subconscious self-sabotage. And what I started calling these, that my clients really seemed to relate to, was blockers. These are what I call blockers. In other words, a blocker, we can say, is a symptom. It's a symptom of an unconscious resistance to change. In other words, all of those things, the lack of motivation, inability to lose weight, the chronic pain and injury, the food addictions, like I talked about last week in the Kick Your Cravings, these are really just symptoms of a deeper issue, a deeper underlying cause, which has its basis at the subconscious level. It's in the mind. So I'm not saying that these are always sabotaging issues. I'm just telling you, in my experience, that these are some of the common things, and I'm focusing today specifically on health and fitness and weight loss and all of that type of stuff, but you can really look at this for any area of your life. I mean, you can find those symptoms for relationship, for work, for finances, all of it. Again, blockers are simply an unconscious resistance to change, a symptom of an unconscious resistance to change. And so what's interesting is that science is really telling us something new now. And that is that our thoughts totally affect our biology, or our thoughts have a complete effect on the biology at a cellular and molecular level in our body, and that will determine whether we experience in our life, whether the expression of our bodies is that of health or that of disease, right? So just to go a little bit further into this, remember last week I talked very shortly about the science of addiction and what happens biochemically in the body with addiction. Well, it has been for many, many years, and I'm sure that most of you in this room have heard of the gene for cancer and the gene for diabetes and the gene for heart disease. Well, what science is now telling us is that it's not our genes. We are not controlled by, our expression of health in our life is actually not determined by our genes, that our genes are like a blueprint. So if you have a contractor who's building a house, right, he needs the blueprints from the architect so he can see what to build. Our genes are the same way. I have the same genes as you have, and you have the same genes as he or she has. And essentially, as human beings, we have a certain type of genes, but the expression is called the genetic expression of the gene is determined by our thoughts. Primarily, there's a couple of other things as well, but they've found that our thoughts affect the inner biology, cellular, molecular level, so that the expression within our body is either that of health or that of disease. It's like going in and turning on the key for health or the key for cancer or the key for whatever it is, diabetes or heart disease. This is a totally new paradigm to come from, because we live in a society, in our Western version of the world, we can go to the doctor to fix us, and the doctor fixes the symptom by giving us a drug, or we get fixed by having the surgery. Now, I'm not saying in any way that those are not valid, because they're Western medicine has its place and it's absolutely valid, and I think that you'll find even the scientists who have found this information about our thoughts and beliefs will say, yes, Western medicine has its place, it's valid, for sure. But can we now step into a new paradigm in which we can consciously choose health for ourselves instead of being a victim of our genes or a victim of the, falling off of the sidewalk or the curb in the wrong way and twisting our ankle, So I'm putting that out for you just to consider, and I'm inviting you to open to that possibility for the rest of the discussion that we have here.